and we'll give you a nice adjustment. Adjustment means to line up the bones. And she's struggling. I'd like the camera person, thank you, to come in tight. And you can see her left foot is shorter than her right. It's dramatic. So you did a good job on your trip. It looks like you're all twisted up. Let's get you untwisted today. Here we go. The left leg is short. Emily's left leg is short, and it stays short. And I'm going to use a handheld instrument. This is called an activator instrument to line up her knees. Which knee's giving you the most trouble?
The right knee.
All right, I'm going to do them both. Twisting them both up. Look at that. That looks more even already. Is that wild? And I'm going to push on the knee and work on her talus. That's called a talus. And her cartilage in her knee. And you might walk out of here feeling wonderful. But we'll put chiropractic to the test today. And I'm using a leg length analysis to determine what's going on with her knee. Here we go. And we'll see if we can't get it lined up better. Check out her heels. Good stuff here. And your hip too, because the hip's giving you static, and I'm going to adjust that. Here we go. So that looks better already. Her leg lengths look better already. And let's do an analysis of her lower back and hip and everything else. She's been traveling, sleeping, different places, right?
Yep.
Carrying luggage and sleeping on the plane. Right arm on your lower back. It can be challenging, and I'll help you meet the challenges. Arm back to your side. Left arm on your lower back. Arm back to your side. Here we go. And I'm going to put your sacrum back in place because it's tipped up. Take a deep breath and exhale and let that just relax a little. Sit the sacrum. How'd that feel?
Good.
Good. Put both arms on your lower back. So during each of these tests, arms to your sides, the legs should be even. Right arm to the side of your head. Arm back to your side. We're going to check out Emily, and then we're going to adjust her husband, Robert. Left arm to the side of your head, because he's all twisted up. Arm back to your side. He was Gunga Din for the trip, right? He was the porter, I guess.
Sherpa.
Sherpa. Pull your shoulders back, Emily, and relax. Turn your face to the right when you can. And you can see when she turns her face to the right, that right leg comes up way short. So it shouldn't do that. And it's an indicator that her back is out of alignment here. Take a deep breath in and exhale and let that that's beautiful. That adjusted beautifully. You relax right into that. And you could see that her leg lengths are more even after the adjustment. So she went from right short leg to dead on even. Head in the center. So lift your head up. Tuck your chin towards your chest. Traditional adjustments. You can see that right leg shorten up when she does that. Look over your left shoulder. And I'd love for you to roll over on your back and please face up. I will give Emily, slide down a little bit, a nice traditional adjustment by hand. As we do that too here, you could feel that's all knotted up on the right side. Here we go. Did you have headache yesterday or today?
I mean, a little bit. I just feel jet lagged.
Okay. We'll help you recover. This is a good time to get adjusted.
Yeah.
Turn your face to the left. Let this go all the way. And let this muscle just relax and just relax. Take a deep breath. Let your head and neck. That's the one. Here we go.
Yeah.
Tell the audience how that feels because they didn't know anything about it. And go ahead and throw your legs this way and stand up, please.
Okay.
Walk around. I want you to see how your knees feel right now. How does your knee and hip feel?
Good.
Is that a little easier?
Yeah, it's still tight in here,
All
but
right.
it feels.
Bring your hands to your side and right at the tip of that finger, right on that seam. You can stimulate that for 1 to 2 minutes and get relief from the TFL, from hip pain, and it'll help integrate the adjustment that we just made.
Okay, great.
So Robert's next, and Robert, tell him about your back. Come this way, sir. Look at how he's standing. Can you see he's tipped off to his left?
Yes. It hurts.
I wanted them to notice this.
Lifting heavy luggage for
Okay.
a 1 month trip in Europe can
Twist you up
can
pretty
twist you
good,
up
right?
on the last day before you fly home.
Of course. All right. So he's tipped to the left, and we're going to do a before and after study. So
Okay.
you and the audience will be able to say hello to Germany and England and Canada. They're out there.
Hey, everybody.
There's a global audience. There's over 1,000 subscribers now.
Nice.
Go ahead, lay
Guten
belly
Tag.
down. Guten Tag. Ciao, l'Italia. Siamo qua in America. Here we go. Let's check out his leg length. Can you see that left leg is short? So she had a right short leg. He's got a left short leg, and it stays short. So we better adjust him today. Adjustment means line up the vertebrae. And look at that. That's pretty wild, huh? So even pressing here, even pulling here, doesn't change anything. It's a real discrepancy. And we're going to have to line up his back. We'll do some tests today for the spine and nerve system. Left hand to the side of your head. Arm back to your side. Turn your face to the left. Head in the center, head in the middle. Lift your head up, please. Relax. Tuck your chin toward your chest and relax. So primarily I'm thinking the lower back and hip. Is that true?
That is very accurate.
Alrighty. But the
Lower
rest
back,
of it looks
sacrum,
pretty good.
hip.
Yeah.
Everything
The
else feels good.
Yeah.
Just down here, it's
Yeah, it's goofed up, huh? Or subluxated would be a better word.
and
Lay on your
much
left side and
tighter
face me.
on this side
Got it.
than this side.
Well, let's do something about it. When you can, lay on your left side and face me. Here we go. Here we go. And here we go. That's beautiful. You okay?
Mm-hmm.
Yeah, good. Here we go. So you might feel a click when I do this, but
Yeah.
you understand how chiropractic works.
Yes.
There we go. I'm going to relax here. Bring the shoulder back. This is all twisted up. Take a deep breath. And exhale. And let that. Yes, sir. That's beautiful. There we go. Go ahead. Lay on the right hip. Face this way, please. Here we go. Take your time. Breathe. Here we go. So there's a power within. It flows energy over nerves, but if the spine's crooked, it blocks that flow. Have you had numbness or tingling down your legs?
Yes.
So I'm going to do something about that. I'm going to take the pressure off your nervous system. Bring your leg forward like this. Yeah, here we go. Bear with me, because this whole pelvis is twisted up. He's done a good job bending, twisting, lifting, luggage over and over again. Bring this left shoulder back, take a deep breath. And exhale and let that just, yes sir, that was beautiful. There you go. Now, go ahead and throw both legs off, sit up for me. There we go. Take a deep breath. Stand up again. And go ahead, face the audience, because I wanted them to see the difference.
Definitely straighter, but
Yeah.
obviously it does still pain, but
All right.
I'm not leaning.
Beautiful, yeah.
Actually hurts a little to
you
lean.
straighten you out, yeah.
Straightens.
That's a healing posture. Your body's telling you what's
Yeah.
right and not to lean into that pain. This is nothing that you work out or work through.
Yeah.
In fact, you should be using ice. Ice it down 5 to 20 minutes at least 3 times a day. Don't use ice too much because you're fair skinned. You could burn your skin easily. Use ice. Avoid things that aggravate it, particularly sitting. And when will we see you
Oh,
next?
yeah. Monday,
We look forward
and
to
it's
it.
Friday today, so as soon as I can get back in.
Emily, come back into the
Yes.
picture. They're wondering if chiropractic works and how it helps the body, and they're still scared in many instances to get adjusted. What would you tell someone who's holding back or reluctant?
Absolutely do it.
There you go.
It's the only thing that ever helps my back or any of my pain in my legs, hips, or back.
Wonderful. How about you, Emily?
Absolutely. I mean, it helps hip, knee, lower back, upper back for me. So we're
Yeah.
very thankful for you and all that you've done for us.
Absolutely.
Share if you care,
Yeah.
like, comment, subscribe, and I'll be back with something powerful and positive for you and yours.